Hi, today it's April 8th, 2022. Again, my name is Yannick Dentis. I am a family nurse practitioner based in West Palm Beach, Florida. I would like to greet everyone who have chosen to listening to this video. And this is a continuation of the teaching regarding disorder of the brain and nerves. We're going today. It's the topic will be meningitis. Um, before we start with the topic, let's say what God words says about disease and healing. Um, we're going to go to James 5, verse 15 and 16. Verse 5, 15 and 16 state that, and the prayer of faith will save the sick, and the Lord will raise him up. And if he has committed sins, he will be forgiven. Verse 16, confess your trespasses to one another and pray for one another that you may be healed. So, meningitis, this is uh, this is an epidemic disease that we call cerebrospinal meningitis. So, if you see, that picture, it's you have cerebral fluids along your spine. When the spinal fluid is infected by either by the virus or bacterium, so that can travel through your brain stream and go into your brain and cause the meningitis. So, what is exactly meningitis? So again, this is an epidemic disease called spinal meningitis, and that this is caused by a bacteria, can caused by a bacteria called meningococcal bacterium. And where can we find this? Okay, that organism, that bacteria usually lives, inside your nose, inside a healthy human being nose. So we are carriers of that bacteria, but in a healthy in a healthy individual, that not going to cause us to be sick. Um, and also he said, but sometime depending of your condition, sometime that can infect your blood and your cerebrospinal fluids. The most common cause of bacterial meningitis is an organism. It's an organism called Haemophilus influenza type B. Also, that can result also from uh, head injuries and infections involving the eyes, the ears, nose. We can have meningitis also after a complication of systemic disorders, such as pneumonia or syphilis. So that can cause that. So both of those diseases, which is pneumonia and syphilis, can reach the brain through the bloodstreams. Usually, most often, they diagnose that condition, which is the meningitis. The diagnosis usually by doing is a spinal tap, which is the same thing the lumbar puncture. So they put a needle, on your on the lumbar spine, and they collect the fluids and they send that to the lab. And after that, we can know for sure if that individual is affected by that bacteria or the virus. We do have a vaccine against influenza type B. That vaccine was approved for use since 1985, and that's why the infants, they are vaccinated for against meningitis at age 0, 2 months, and 6 months. So that's why they have the newborns. They have three vaccines against that. So even though that disease is rare now, but now and then we heard people still, children and adults, they still can be infected by that too. And also the literature said that children and immunocompromised people, they are most at risk. So what are the symptoms of meningitis? So again, we have, we can have two kinds. There's two kinds of meningitis. It can be viral or bacterial. So viral means that caused by a virus, and bacterial means is caused by bacteria. So the symptom, if it's viral, we can find that individual can have a headache, worse when bending. Like, let's say someone is trying to pick up something on the floor, so that the headache will be worse. Fever, vomiting, stiff neck, and also in case of severe condition, we can have muscles weakness. We can have also paralysis, impaired speech, double vision, and epileptic fit. Like seizures symptoms. The bacterial symptom, which we can call it also meningococcal meningitis. So the symptom can be any of all of the above I just mentioned. Your headache, your fever, your vomiting, your stiff neck, your muscles weakness. The bacterial also can cause someone to have the symptom, and in plus of that, in bacterial infection, you can find a rash of red spots on the trunk of the body, and also you can find drowsiness and even coma. convulsions and a characteristic high pitch cry. We can find that in babies and infants. So the infants, if you have an infant or a baby who has a high pitch cry, confusion, so you need to seek immediate attention. You need to bring that kid, that baby, that infant to the emergency room, where they have a good ER peds, as soon as possible. And also, in infants, the fontanelle, the top of the head may be bulging or feeling more tense than usual. What are the caution we have to do? Meningitis, even though we have vaccinations for meningitis. Meningitis, when someone have that disease, that can be serious disease, and that can lead to brain damage, that can lead to blindness, death, and even dead. Can die with that too. So that condition, which called meningitis, if somebody is suspected to have meningitis, this is you need to seek attention. This is an urgent condition. The medical attention is required as soon as possible. If somebody is suspected having, those symptoms, so that person needs. This is an emergency condition. So it's you have, this is urgent. It's urgent. You need that individual needs to seek medical attention. This is a must. And the specialist who's going to see you and who's going to treat you is a neurologist. Okay, this is the brain specialist, brain and nerves specialist. Treatment for meningitis, if suspected, the only thing you need to do is to go to the emergency room, the nearest emergency room, or call 911. If you if you are really sick, you call 911, or if somebody can bring you to the newest emergency room as soon as possible, so you can seek the treatment as soon as possible. So in the literature reviews, we see that some treatment, they said there is the Chinese herbalist or homeopathy or flowers essences, but I wouldn't mess up with those things. If someone is suspected to have meningitis, either viral or bacterial, you need to go to the emergency room as soon as possible to get treated. On that, I will stop here, and the next topic will be encephalitis and Parkinson's disease. Will be the next video. So I want to wish you best of health until the next health video. Bye bye.